Okay, I think that's about it for now. Margot, I'll go ahead and turn the meeting over to you for opening.
Sure. Good morning. Nice to see everybody. Not a lot of updates from me today. I did have a good call with our board chair, Donna, and our 5 park superintendents last Thursday, just to get basic updates from everyone. Not much has changed in status in the parks. Pukahola, I think last Friday, announced that they're pausing their next phase of reopening there, as are we all, keeping an eye on what's going on Oahu and the trends in COVID cases and so forth. And so we're holding our breath, hoping they can get it together, people. Anyway, see how, so that, that could impact inter-island travel and what the parks are thinking in terms of their reopenings and all that. So we'll just, keep an eye on things. Visitation's still light at Hawaii volcanoes. We found out yesterday that the park is working on issues with a door install at Kilauea Visitor Center, which could prevent us from getting back into KVC as soon as we'd hoped. They're working things out. The contractor has a couple weeks to figure all that out, but yeah. So patience, I guess, is the name of the game here. And that's really it for me for the moment. Mahalo. Does anyone have any questions? Anything? Our flooring project is done at admin office, quarters 15. I'm sure Mona is happy about that. That was quite the undertaking there.
All right. Well, we do have a few more minutes before our guest, our representative from HMSA does join our call, and that would be Luahiva Namahoe. So I think I'll turn it over to Mel, and if we have time to go around to each manager, so let's see. We would have approximately 10 minutes before Luahiva joined us. So Mel, I'll turn it over to you if you'd like to go around to the managers.
Okay. Unemployment is probably the number one thing on a lot of your minds. So it looks like we've worked out the remaining issues. If you still have an issue, let me know. Just send me an email saying, you haven't been paid or whatever, but it looks like everybody, fingers crossed, are in the loop. I do have to let you know, I've had a problem. I have not been able to get on the system. It's just, there's been a message for the last several days saying system not available. I think it's on the employer side, not on the employee side. And then when I'm able to log in, it takes me to the employee page. So I'm not sure what's going on there. So just like 5 minutes before this meeting, I was finally able to get on. With hope that hasn't held any of your payments up. I will be putting in the low earnings reports for all of you ASAP. Just as a reminder for Luahiva, our HMSA rep, what she'll be going through is Quest. And if any of you don't know what Quest is, please let me know now and we can talk about it. These are the options we're talking about for medical coverage under our HMSA or whatever. So there's HMSA Quest. There's other things besides that, but that's the one Luahiva will be talking to you about. And then Cobra is another option. And then finally, for our employees who are over 65, Medicare. So if you don't want to stay on the whole call, or if this doesn't impact you, you can leave as soon as we're done with this little 15-minute talk, or you can leave as Luahiva goes through the programs. Like if you're only interested in Quest and you want to leave then after she talks about Quest, you're certainly welcome to log off. You don't have to stay on for the full 3 hours. This meeting's scheduled to go until 1 o'clock. Luahiva's wonderful. She's extremely helpful, great support, but she is a salesperson, so she does talk. So it might go the full 3 hours. I'm just letting you know. Other things, web sales, big girl, attaboy for Kiri and Al and the gang, Judy, Kim, all the work you've been doing on it. We did over $11,000. So that's a huge jump. And Kiri, if you're on the phone, I'd love to hear from you about that, or on the Zoom meeting, sorry.
Morning. Yeah, I'm pretty stoked on how much orders we had this past month. It's good for us. It's like working on during the holidays. So I've been busy packing up all those orders, even Al. So, yep.
I know some of the promos really helped with that and people getting the word out. So yep. Excellent. So yep. Good job.
So we should be having a promo, I think for the next 3 weeks, Kim. Yep. So 4. Okay.
Good. And one final thing. We've been holding off, as you know, on vendor payments, and that is still our plan. Margot's had some calls with her peers, or conversations with her peers, and you know, that's what we're hearing is try and hold off as much as you can. But we are getting pressure from our vendors, some vendors, to pay. So Margot went through the list, and then I'm going to confer with the area managers, and I'll be making personal calls to each one of the vendors where we've held off on payments. We are making some small payments here and there. The goal will be to negotiate terms. I mean, it is our obligation. We need to pay those invoices, but we're hoping to be able to make installment payments and even delay a little bit further until more is known about what's happening with the pandemic. As you're aware, the government still has not finalized a relief plan. They both have, the Senate and Congress have 2 different plans in place that now they need to bring together, and they're still working on it. So I'm hoping, President Trump has said that he'd like to have an emergency plan go through to at least help with unemployment. So I'm hoping they'll at least do that until they work out the kinks on the bigger, broader plan. But so far, there really hasn't been any real movement. Sometimes that happens and then all of a sudden they get it done, but I just wanted you to be aware of that. The state of Hawaii also looked to pass a emergency plan. Governor Ige vetoed that. Because of their situation. The government, the state of Hawaii's economic situation isn't that great right now. So that was a big driving factor with them not knowing what's going to happen. He didn't think it was wise spending at this time, especially given that the federal government with hope will be coming through soon. They're working on modifying it so it isn't like it's dead in the water. But that version of it has been vetoed. So hang tight, and with hope we'll have some relief. Your regular unemployment is still fine. It's just that 600 stimulus that has now expired. Any questions for me? Nope. Who wants to go next? We just have a few minutes before Luahiva comes on. So,
Mel, this is Carolyn. Just to let you know, I do have Luahiva waiting in the waiting room. She is a few moments early. I did let her know that I could see her. So if we want to keep her waiting a little bit longer, that's fine. I've texted her to that. Or if we want to bring her on in, I'm going to let you make that call.
Mary, Al, Michelle, Kim,
I was just gonna say I don't really have any updates other than to let you know that I think Jen is back from vacation today, so hopefully we'll hear at some point this week what she's thinking about doing with us. Thank you.
Anybody else?
Hi, everyone. So not a lot of new updates for the West Side either. Cajo, Pujo, Interp staff is there Friday through Sunday. Visitation is low. A lot of Oahu visitors coming in. Puhe is open on the outside. Rangers are roving, and we're all just kind of in a waiting mode. Everything's set up at the stores. We're ready to go whenever that time comes. Oh, and we did some training last week. We're set up for this week again to continue with that for our operations and new procedures, policies, and things of that nature. Thanks.
Well, for Havo update, I mean, what Margot's already mentioned is just the door issue right now. So that's it.
And for creative services, there's just ongoing promotions that are being produced and overseeing any communications that are happening. Already missing Judy a little bit, but she has stacked the promos and social media. So we're in a very good position social media wise. Also, thanks again to Emmy for the video that she created on the tea leaf lei. I checked, we've gotten 41 direct hits to YouTube, but it also was shared quite a bit, and a lot of thanks from the park and the parks, the Westside Parks, all communicated their appreciation for your hard work and care in making a really great quality video. So thank you again, Emmy. That's it, really. Thanks.
Okay, any comments from the team before we have Luahiva come in? No? All right, so Carolyn, if you wouldn't mind.
All right, I'll go ahead and admit her. One moment. Hi, Luahiva. This is Carolyn and the staff of HPPA. Can you hear us all right? Let me see. I'll try that again. I can see that
Hello?
there we go. Hi, Luahiva. This is Carolyn and the rest of the staff of
Morning.
HPPA. Good morning.
Good morning, everyone. I believe I see Carolyn's face. I don't see the slides. Am I able to
Um,
have your screen shared with me?
Sure, I can do that. Okay, can you see that first slide?
I do.
So-
Let's go to the view, you know, on the bottom, at the very bottom where it says notes, and then 3 over, 3 to the right of that. 1, 2, 3. I mean 4 to the right of that. Next one. Nope, not reading view.
the
Next one.
slideshow.
Slideshow. All right. Thank you so much. Good morning, everyone. So let me make sure that I have my chat bar open. Okay, welcome, Luahiva. All right. Just to make sure that I take care of some of the housekeeping so that I'm on page with everyone. If you do have questions, are you all able to type them into the group chat? Somebody say yeah.
They're nodding their heads.
Yes.
Okay, all right.
Yeah.
Okay, all right. Thank you so much. Thank you so much for the time that you're all providing me this morning. I know that this is a very sensitive situation. To the next slide, please. We have only 8 slides today. My goal was not to inundate you with data. If you take away nothing else from our time this morning, the goal are on these next 2 slides, which is where you can access your information. So please, if you're taking notes in whatever form of media that you're doing that, am I correct that there are 3 populations? When I say 3 populations, I'm using demographics, geographics. So I have a quote unquote East Hawaii population, West Hawaii population, and Maui population on the call. Is that right?
Correct, yes.
Okay, thank you. You may see these little logos on the bottom. And these logos just let you know that what you have available to you on the different islands. That purple plane there means the Care Access and Assistance Program. As I go through the quick overview of the 3 options that are available to all of you, and those options are MedQuest, COBRA plans, and for those who qualify by age, Medicare plans. All 3 plans have these available to them, regardless of how you need to cover your family effective September 1st. At the time, if I need to be corrected, if I'm getting some of the initial dates wrong, I'd like you to please listen to it more as a placeholder language and refer back to Mel Bull. She'll be your final authority on those data points. We're all good? We're clear with that? Yeah? Yes?
Lots of nodding their heads. People are going
Lots
to
of
be
nodding.
people are going to be muted so that we don't collide with you.
Okay.
I'll keep myself live and be as quiet as possible so that I can answer anything that you have to say, Luahiva, and that we can confirm
Perfect.
that I'm on the right slide.
And again, I've also got the group chat going on the side, so my eyes are going to switch back and forth between the 2. I want to respond to questions if you have them. No such thing as a dumb question today. So regardless of which of the 3 plans I'm talking about, this slide really talks about access to you. If you're in East Hawaii, and if coming to the Waikea Center Inc., if coming to Walmart or Walgreens or Prince Kuhio Plaza is accessible to you, then please note the times. Our neighborhood center, our HMSA center, is on Maka'ala Street. It's between Walgreens and the Texaco gas station. And it's open 6 days a week. So 9 a.m. to 6 p.m. It's all walk-in. no appointments, and Saturday from 9 till 2. For the types of questions you might have, I'd like to recommend you give yourself an hour when you come down to see us. In Kona is still our old branch model. It's on the 3rd floor on Henry Street. So you're coming into Kona town and you go to Walmart, and then Mauka of Walmart is Safeway. The building that's Mauka of that is HMSA is on the 3rd floor. You see a big banner on the outside of the building, and that's literally the banner outside of our office. So you park in that parking lot and you go to the 3rd floor. That location is open 8 till 4, Monday through Friday. And again, these icons on the bottom of this slide, the purple plane means Care Access and Assistance Program. The blue icon means that there are doctors that will take your plan. U is for urgent care, H is for hospitals, and we have over 27 pharmacies on this island. For a current list of participating everybody, or as we call them, providers, use the Find a Doctor tool on hmsa.com. So for those of you who need to click, you go on your device or your iPad phone or your desktop, and if you run hmsa.com, in the top right, you'll find the Find a Doctor tool. It will literally look like that blue icon there. Next slide, please. We do not forget about Maui. So the Pu'unene Shopping Center next to Target is our HMSA center there. Again, like the Hilo location, it is also open 6 days a week, all walk-ins, so 9 to 6 p.m. and 9 to 2 p.m. on Saturday. Again, if you're gonna go in, please try to get in an hour before. Give yourself time to think of the questions. I do notice that we have here, we put hospitals for the other islands, but if I'm not mistaken, there are no HPPA staff on either Molokai or Lanai. Is that correct?
That is correct.
Okay, thank you. Next slide, please. So while I gave you the physical of that, this slide, I don't want to overload you with too much information. How do you find out if you are eligible for MedQuest? I'm going to talk in terms of the Big Island. Maui, the data is a little bit skewed, but I'm going to share this. 1 out of 3 people on this island, on the Big Island of 200,000 residents, is on MedQuest. Now, if you knew of Quest beforehand, well, the astronaut icon, what was the astronaut icon for? Astronaut. Did I have an astronaut icon? I am going to come back to that question. I love it. I'm getting messages on the group chat.
I think that
I will
might
get
be the doctor.
It could have been the doctor, or no, it's the airplane, which means all of our plans have care access and assistance programs. I want to stop to say this. One of the benefits of being with HMSA is that if you need to see a specialist on Oahu, then you are able to contact customer relations along with your doctors, and we will take care of the flights to get you to Oahu and back. When you're on the ground, it's, you know, you have to use a shuttle, Uber, your auntie, but the real cost, as we know, is the flights, and we'll take care of the round trip flights. To this slide, and thank you for that question. To this slide, MedQuest. MedQuest is not, I want you to know this, to this first question here. Am I eligible? Before coming into the neighborhood center, I want you to go to this website now and notice it's medical.mybenefits.hawaii.gov, and you're going to backslash to the web, backslash to Kolea, and then backslash to home hyphen page. This will take you to the state's Quest program. HMSA is not the only Quest carrier. We are, however, the overwhelming largest of the Quest carriers. And the reason why people choose to use Quest is because of their provider choice, the doctors. But there are also a few other plans available. And one of the things that we've seen is that when people join Quest, they may get assigned to one of those other carriers, and then they immediately call HMSA and go, I want to go back to HMSA. In order for you to make this decision, I'd like you to call your doctors. Call your primary care provider. Call your pediatricians. For the women, call your OBGYNs. For men, call your urologists. Talk to your specialists. Whoever is currently taking care of you in your continuum of care, you want to discuss the MedQuest option. Quest is no monthly premium. Quest, because of the expansion under the Affordable Care Act, it does not count your household, your wealth against you, not your 401ks, not the value of your home. What it counts is your income. It's just your income. So MedQuest is where I'd like to recommend for those of you under 65, start with MedQuest. Okay? So again, medical.mybenefits.hawaii.gov/ into web, and then Kolea, and then / again into home - page. Next slide, please. There may be some of you who are undergoing current treatments where the idea of going onto Quest and some of the limitations with Quest do not work for you. One of the most broad examples of this are people who have dependents out of state. Maybe you're, just for the example, maybe you're covering your child, you're the non-custodial parent, or maybe your child is now a kidult and is living in the mainland and is underemployed and lives in a state where he or she is not able to get on health care. And so you're supporting that child, that adult child, all the way up through his or her 26th birth month. And so COBRA then is the answer for you. For everyone, if you take nothing else away, your next steps before coming into an HMSA center is to talk to Mel. COBRA, in its broadest terms, is a guarantee that your current plan is your future plan. It is, by law, the definition, 102% of the monthly premium. But because it's the exact same plan, people do choose to keep COBRA, predominantly because Quest, all Medicare, all Medicaid programs are designed to be used within the state that your Medicaid is obtained. So if there is some reason that you need care or your dependents on your plan need care outside of Hawaii, then COBRA is the plan you want to go on. I want to take a moment to see if there's any questions on this particular plan. And again, I am keeping it high level. And again, your next steps are to talk to Mel. The fundamental differences between Quest and COBRA is there is no premium per month captured from Quest. The plan is a little different. It's medical drug under Quest. Under COBRA, it's your current medical drug, vision, dental. But you are able to use that broadly, like you can use your HMSA. But there is a premium that needs to be captured monthly. And again, you need to speak with Mel on that. If you do take Quest, I do recommend you go into the HMSA office and pick up an individual dental plan that's somewhere around $40 a month, because you will not have dental under Quest. So I kind of went through that pretty quickly. I'm going to sit here for a second and watch group chat to see if there are any questions.
Louise, I have a question. I'm not going to do it in chat. Under Quest,
Okay.
so there's no premiums. Is there any co-pays or anything like that? Prescription?
One of the beautiful things about Quest is that there are no copays. There's no monthly premium and there's no copays. One of the questions that I had is, do I know the income limitations for Quest? I do not. And so that you all know, that really needs to be the conversation between you and all the staff at Quest. Even if I knew, I'm not allowed to say. So no, I don't know. And it changes. It slides on the family. But I do know, I can answer this. Under the Affordable Care Act, and you can look at the slides, Hawaii was given a very generous scale. So you can Google online and look and see that we are 400% over the federal poverty level, FPL. So look under 2020, Medicaid eligibility. I'm sure those tables are available online. But otherwise, I don't want to drive you in any other direction than to go to the state's website, which is medical.mybenefits.hawaii.gov/web/polea/home-page. Other questions?
Now, just another comment that I wanted to stress. You talked about assets do not count. I know there's been a lot of talk, or there used to be, that assets do count against it. There's that perception out there that if you've got so much savings in the bank, or you've got, you own your house or cars or whatever, and one of our former employees was very emphatic that counted against you and you couldn't get Quest. So could you just clarify that for me, Luhiva?
With the expansion of the Affordable Care Act, it was known as the Medicaid expansion. Hawaii was one of the first states with Medicaid expansion. And so I have heard that too. And I've also, I do recognize that there is a struggling perception of it can't be as good as commercial health care. So when I say commercial health care, any insurance that is obtained through employment is technically known as commercial health care, because this is a commercial plan. Commerce meaning that it is through an employer. That's the classic definition. But we were the first state under the Affordable Care Act. And while a lot of people have watched the national news, when they talk about ACA, it's very different state to state. Hawaii was one of the 3 states that had stricter healthcare laws than what Affordable Care Act was going to herald in. So I don't want to go down that path too much. That right there is its own 3-hour discussion. It is the largest law on the books. It's larger than Homeland Security. It's larger than Medicare. It's larger than ERISA. So I'm going to say, check it out if it's free. And also, when I say it's free, we pay for it. We're taxpayers, we pay for it. You won't be on it forever. You won't. So you're needed for this period of time. And I am very sensitive to that. Our staff at all of our HMSA centers are very sensitive to that. We do need you to go onto the state's website. You don't have to call them. You can do it online. Per my understanding, they're very quick. Then you take that information and then you're equipped. Come into the HMSA Center and talk to somebody. And we're going to get through these hard times. We will. Next slide. So these next 2 slides are really for the Medicare population. How many people do I have? I'm going to say 64 and over on the call. Less than 5? More than 10?
I'm gonna go with less than 5.
Okay. Okay. For every other person on the call, you do not need to sit in for this portion. Let's say you're 63 and your spouse is on your plan and your spouse is 65. You're welcome to stay on the call. But I've held Medicare back at the end because seniors have their own unique needs. So Mel, do you want to let the others go from the call, or shall everybody sit through this portion?
No, they can go. I just want you to know I provided the link in chat for the Quest eligibility that Luhiva mentioned. I've been playing around with it. Super easy. And it looks like you could be making a pretty good amount of money and still be eligible. I'm just going to say that. So go in and do it yourself. It's about 3 questions that you have to answer. There's about 5 or 6 questions, super simple. And then there's a link to apply now if you want to. But as Luhiva said, you know, let's talk. So let's, I'll probably just set up one-on-ones with all of you, and we can just have a quick chat about your status and options for you. But Quest looks like it's very easy. It does not ask any questions about assets. It just asks about income level, who's in the household, age-wise. And like I said, I put in a whole bunch of different income levels and I got it pretty high. And so I think all of you will be eligible for Quest, but we can talk about that. Okay. So thank you for joining us. If you want to leave now, you may do so.
Going forward, I've got a kupuna seminar ahead. Thank you. I have had a few people that have reached out to me to say that they are eligible. So, time for a Medicare seminar. Medicare. This is the link on this one. See, first you can see, get parts A and B first. Medicare is one of those parts A, parts B, part C, and parts D. And there is this web page here. You can go on to HMSA. Please notice that the neighbor islands have different plans than urban plans. Everything to do with Medicare and technically Medicaid is governed by the federal agency known as CMS. It should really be CMMS because it's the Center for Medicare Medicaid Services. For some reason, they just call it CMS. HMSA is one of the carriers that offers plans as approved by CMS. I do want to go to the next slide, please. This is the important one. Part A. Part A comes free on our 65th birthday, provided we work 40 quarters. We pay no premium when we turn 65. Part A covers approximately 80-ish, 20-ish of hospital care. If I have a senior currently, I'm just going to say, we're going to call him Joe Blow. So Joe is your kupuna employee who's working more than 20 hours a week at 4 consecutive weeks, which means per the state law, he is obliged his full health care under HPPA, but he'll have dual coverage if he has Part A. Because for him, having been a lifetime, a good citizen, a gainfully employed citizen, he made more than his 40 quarters, more than his 10 years. And he he qualified for Part A. That means, knock on wood, if he had to go to the hospital, what HPPA doesn't cover, his Part A would cover. Part B starts at 65. Everyone who's turning 65 has a 7-month special enrollment period. 3 months before their birth month and 3 months after their birth month. So now, again, going back to Uncle Joe Blow. So now Uncle Joe, his birthday is in May. When he turned 65 in May, he had 3 months before May. He had the month of May when he turned 65. And he also has June, July, August. He has that 7-month special enrollment period where he hems and haws. Do I need Part B? I don't want Part B. I'm going to stay on HPPA. I don't need to pay Part B. Part B in 2020 is about 135 bucks a month. And they take it out every 3 months from your Social Security payment. You do not have to take Part B when you're gainfully employed and you have full coverage through your employer. However, if any of you have been in those shoes and are currently 65, then before 8/31, I want you to go to the Social Security Administration. Or you can go online. I don't recommend going online. I do recommend going to the SSA office. Unfortunately, in Kona, only at Ane Kyohokalole, the West Hawaii Civic Center, they do have volunteers 2 times a month. There's only one Social Security office on the Big Island, and they're in Hilo. I will say they have been very effective. And I have had people say that it's been effective to do this online or to do this on the phone. But I often find that when people are 65, they need the tactile face-to-face experience. Part A and Part B, by the way, covers doctors, also 80/20. Together, Part A and Part B are known as the specific title of Original Medicare. So now, if you are 65 and you never took your Part B, I need you to get your Part B before 8/31. When your new Medicare card comes in, then you look for an Advantage plan. An Advantage plan is the C and D. We've heard of UHC and ARP. They offer Medicare Advantage plans. There's other people that offer Medicare Advantage plans, and then there's some that don't offer a Part C at all. They offer a Part D, because by law, you're required to have a Part D. You need to buy a drug plan, prescription coverage plan. I'll talk a little bit about HMSA. We have a plan called Akamai Advantage. That allows us, HMSA, to be the C. We're the carrier. We manage your claims. We add additional benefits that cover the Part A and B, i.e. the deductibles and maximum out of pocket of $3,600 a year. So that, knock on wood, if you wind up, my favorite example is a stroke. You wind up in the hospital, after 3 days, they put you at a skilled nursing facility. You have 100 days there, occupational therapy, physical therapy, as they're teaching you to take care of yourself. And by the way, nobody plans for a stroke. And 1 out of 3 people walk into retirement in an unplanned fashion. A medical emergency takes them there. So you get your A and B, then find an Advantage plan. The Advantage plan is the C and the D together. So it'll offer that drug plan as well. For those, the first steps are getting your full original Medicare. You need Parts A and B. This can get very, very technical, and it's overwhelming when I start throwing alphabets at you. I'm looking to see if anybody right now is over 65 on the call, and answer me this question. Are you over 65 and you only have Part A and not Part B? Message me, that's me. Raise your hand. Okay. All right. So to my HPPA employee, to the Uncle Joes on the book that are losing health care by 8/31, you need to, today is 8/4. You need to either go on a Social Security's website or find your local Social Security office and get your Part B. Again, it's $134 a month. Also, apply for Low Income Subsidy, LIS. If you will only be predominantly living on what you're able to get from Social Security, you will most likely qualify for LIS, and that will lower your premiums. Whether it lowers your $134 a month, which is what you pay for Part B, or it lowers whatever your Advantage plan is. We do have 2 Advantage plans on HMSA. I don't want to talk too much about cost. You can go online and look on the neighbor island plans and see those costs for yourself. You also can look and see what other plans are out there. Let me tell you how technical the government is, because I've seen this happen before. Somebody bought a HMSA plan and then turned around and bought a UHC plan, thinking I will take care of the 2 plans. I don't mind spending that every month. I've got 2 coverage. That's not how it works. CMS kicks off the earlier one and only keeps the plan that you signed up for last. In CMS mind, there is no dual, you're only replacing. So you need A and B, and then you need to find either a standalone Part D or a Part CD combo known as an Advantage plan. Do I have any questions for that? Okay, then I'm going to give you a question. So let's say by Thanksgiving, we have an effective vaccine. Everybody takes a shot before Christmas. Hallelujah, come January, we can crank this economy back up again. So now, here I am, I'm a young 65-year-old. I want to come back to HPPA. They're willing to have me back. I intend to go back onto my health plan. But now, Luehiva, you told me I needed A, B, C, and D. So I got my A and B, and I got my Advantage plan. Then what? All right. If you go back to HPPA and decide that you're going to only work truly part-time, 19 hours or less, stay on the plan you have. If you go back 40 hours a week or 25 hours, if you go back full-time per the state law, you will only drop your Advantage plan, your C and D. You will keep your Part A and your Part B. That you will keep. Your C and D, you're able to replace back with commercial coverage. Does the Advantage plan cover your copays? The Advantage plan adds additional coverage that shrinks your copays. So if you just had, let's say you only had A and B and you just bought a Part D buy-up. One of the things with A and B is there's no maximum out of pocket. So let's say it's the poorest form of Medicare supplementation, is if you didn't put a wrap around your A and B. If you needed a $250,000 angioplasty, you would be on the hook for $40,000 of that. An Advantage plan will cover you after $3,600 a year. HMSA would pay 100%. So it has a lot of wraparounds and it makes the copays much more painless. Good question. Does it cover your copay? It gives you smaller copays. And it gives you a maximum out of pocket per annum. And that right there is what's going to protect your senior wealth. Other questions? If you take nothing else from this, the main points of this section is get your A and B, and then look for a Medicare Advantage plan. Whether you come into HMSA and get an Akamai Advantage, or you look for another Advantage plan. Are you limited to a certain number of doctor visits a year on Part B? Oh, they love to take your money. Okay, that was sassy. Let me say that again. Get your care. If your care requires that you see your doctor 4 times a year, that's great. But if you're one of those people that's fighting, it's been a really hard year, so it is. Get your care. There's mental health services. I'll also say this. Under HMSA, Under HMSA's Advantage plan, we still have telehealth. There's no copays on that. That's 24/7, 365. If you have a device, you can have that FaceTime / Skype experience, this, you know, this, like this Zoom meeting. Good questions. Any other questions? Again, get your A and B. Get your A and B. And then look for your Advantage plan. HMSA, you can walk in for that. We've also seen them sitting outside of the supermarkets. I saw them outside of Safeway. There's more than one. Finally, talk to your doctor. Ask your doctor who they take. As with everything, doctor, I'm looking at migrating. Is there any particular coverage that you accept? Is there any particular carrier that you don't accept that coverage? Don't let me sell you. Let your doctor advise you. Good questions. Medicare Part C, does an Advantage plan have a deductible? Well, it depends. Some do. I'm going to look right now on HMSA.com. Hang on a second. You're going to see my profile because I got to look at that monitor. One second. And so the Medicare plans, by the way, they change year over year. There is a calendar to them. So what you will find is October 15th-ish, October 20-ish starts Medicare season. Your enrollment period ends typically the first week of December for an effective change of January 1st. It's a calendar year plan. And they change every year. On the neighbor island, there are two plans here. We have HMSA Akamai Standard and Akamai Advantage Standard Plus. If you look at, if you go to hmsa.com, / hyphens everywhere. Health, sure. You know what? Hang on. I'm gonna put this into your, I'm gonna put this link into your to the, what do you call that? Text box.
Oh, the chat. Okay.
Yeah. But all right, everybody go with me. Or Mel, are you able to open this up and instead of this slide, open up this link?
Yes, I'm going to do that right now.
Right.
And I'll be sending out an email to the whole team with the links along with your slide deck, so they have all the information in one place. So, okay, I'm in. And I don't think we can share screen at the same time, can we, Carolyn?
Yeah, it's not letting, let me try that again. It's not letting me see.
Or Carolyn, is it you who's playing the slide deck? If not, can you instead play the, put up the link for the HMSA plans?
One moment.
Well, I just,
Luahiba, I am recording, so if you've put it in the chat when this ends, I will certainly have that selected and can send it out.
I think she wanted to show people what it looked like,
Yep.
Karen. So can we close
Yes,
down
please.
the slide deck and then have me share screen?
One moment. Try that now.
Over. And share.
There you go.
Okay, great. So some of those questions are like, what are the difference in plans? So let's scroll down a little bit. On the neighbor islands, we have 2 plans here that are available for you. The standard and the standard plus, either $63 a month or $190 a month. Notice I mentioned low income subsidy can help pay for prescription medications and monthly premiums. Look that up. Everybody click on that. I want to go through this. In network, out of pocket maximum. We call this the, go back.
You want me to go back? Okay, hold on.
Yeah, we'll go back because we don't, yeah, we need to stick to the plan because eventually, yeah, scroll down.
Yep, there you go.
Thank you. Thank you. Just later on, ladies and gentlemen, please click that link, the one about finding out more. I want to talk overview. Now, even though we write it as in-network, out-of-pocket maximum, in medical insurance parlance, we call it the MOOP, maximum out-of-pocket, per annum. So the $190 plan, or the plus plan, is after $3,400 a year, we're going to stick with that stroke, HMSA pays 100%. For the other one, the maximum out-of-pocket per year is $6,700 a year. And so I've seen people where I'm just going to run that risk. I don't think I'm healthy. I don't see why I'm going to wind up in the hospital. My strokes don't run in my family. Blah, 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 blah. I see no problem with taking the $63 a month plan. Scroll down. Thank you. And we're going to click on medical benefits. Is there a deductible? Not under the plus plan, but under the standard plan, yes. There is $150 a year for some in-network and out-of-network services. And there's a whole list of what is, where there is a deductible or what's in deductible. So that's the simple language we have on it. Certain visits, your primary care visits and your preventative visits, no, you won't see the deductible. For others, you will. Inpatient hospital care. We always think this is important for seniors because seniors often, this is the time of life where we do face these kinds of spooky concerns. So notice days 1 through 6 or days 1 through 7, whether you're on the regular plan or the plus plan, is $300 a day, a global fee. And then days 7 through 60, it's $44 a day. If you're on the regular plan, if you're on the plus, there is no copay. And then there also isn't for days 61 to 90. Skilled nursing facility. So I do want to talk, we're going to go back to the stroke. The way the stroke works and the way that Medicare works, you go to the hospital, they catch you in the golden hour, you may pay that ambulance bill and that emergency room bill. But if they realize they didn't catch you in time, then the emergency room bill folds into day 1. We admit you into the hospital. There you are. So you know you're looking at $300 a day. Day 2 and day 3 is when they decide. By day 2, they realize, nah, you need your care. You're going to need therapy. We are seeing the stroke was maladaptive to you. We now need to help you recuperate extensively. And so the care of the hospital will be making arrangements for a nearby skilled nursing facility. The SNF, as we see right there, so you know, day 1 through 6, but I just mentioned 3 days. Then you go in, and if you notice, it depends on which plan you're on. In the regular plan, there's no cost for the first 20 days, from the third week to the end of the second month, it's $170 a day. And you'll have 100 days in that facility. And everything is covered in that daily fee. Your bed, those meals, and all of your therapy. If you look on the Plus plan, it's $20 a day. And then days 21 to 40, it's $160 a day. I do want to remind everyone of what the maximum out of pocket above was. So even as you see these costs, and if you play with the 10 key, you may realize you didn't have a stroke on January 1st. You may have had other care. So although you see those fees being what they are, once you hit either $3,400 a year in out-of-pocket costs and cost to you, thereafter HMSA pays 100%. Likewise, under the standard plan, it's $6,700, and then HMSA pays 100%. Scroll back down, please. The other way you get to $6,700 or $3,400 is your doctor's visits. You see the copay, it's either $30 or $10. To see a specialist, it's either $50 or $40. Notice outpatient hospital facility and surgery. If you need to go to the Mustard building for anything, you will see the deductible. Ambulances, it's a fee of $250 or $225. And then the emergency care, urgent care, we split that out because that's technically a specialty visit, but sometimes we don't think of it that way. So you can see the copay there. And so on and so on. Drug benefits, please. Under the standard plan, there is a deductible on medication. I want to say something about medication. The average senior on an Advantage plan, not just Akamai Advantage, but an Advantage plan in the United States requires 14 medications a month. The average senior is, the average senior though, think about where the measurement is. It's 65 and everybody older than that. So I really don't know where that toggle goes. I'm going to say 79. But still, $1,400. If you've heard about the donut hole, this is where we see it. And this is one of the key reasons why seniors, healthy seniors past 65, choose to work and stay on their company plan. Because under a company plan, there's no such thing as a donut hole. Your drug costs are your own. Your total drug cost means it's not just your copay that you see here for generic, preferred generic, or specialty drugs. It's the total cost of the medication. So currently, I'm going to look at three of the common pharmacies. There's Longs, because there's now a Longs everywhere, CVS. Then I know people who love the KTA. And I also know people who love Sack and Save, because Sack and Save, they get the frequent flyer miles, the points. That seems to be fun, pharmacies that are popular amongst our seniors. All of the pharmacies are able to give you annual printouts so that you can see what your total costs look like. I'd recommend you do that. That way you can see if you are going past $4,000 and in which month you do go $4,000 into the hole. Because when you do that, scroll down. Coverage gap. Until your yearly out-of-pocket costs reach $63.50. It is 25% of the cost of brand or generic drugs. So what starts at the beginning of how you fall into the $4,000 gap is the total cost of the medication, not just your copay, all the way to now, once you pass $4,000, until your out-of-pocket is $63.50, it's now going to be a quarter of the cost. And if you're one of those people where you go into the gap by March. I'm just going to do a calendar year example of this. You go in after 3 months, and then you don't, and then you come out after 6 months. You then have a catastrophic coverage payment of it's either the grade of whatever 5% of that cost is, or $3.60. Again, apply for LIS. Talk to your pharmacy. Look for coupons. If this is a concern for you, I understand why senior employees choose to stay on their company plan. It's because of this. It's because of what they call the donut hole or the gap. I've had to explain to a 91-year-old man, because he was on a specialty shot, that he paid, the shot was $2,000 a month. That was the cost. So you see where his costs were, 25%, 33%. He was $680 for a couple of months. Then he went into the gap. He was $900 until he came out in September that it was $120. It's very difficult to explain that math. And no HMSA, no Advantage plan, no carrier came up with that math. That is Part D math as determined by the Center of Medicare and Medicaid Services, their unique mathematic ability to share drug costs with the people who need it. And it started, Part D started in 2003, 2004. For those of you who need to be political about it, you can go and remember who was the president back then. Here we are. So this is the time you do your math, apply for a low-income subsidy, and also talk to your senior friends that are on Advantage plans. What do they use? What do they find? And talk to your doctors. Make sure so that you know drug disruption, to go from a brand drug to a generic drug. You know, this happens on average 5 to 10 times in a senior's life. So get used to that. Also, there's more than one form of generic. Somebody might not like the generic medication because it's the delivery device. For example, I don't like Allegra because that pill is so huge. I'll take anything that's little, like the Claritins and the Zyrtex, because I don't swallow very well. So every time I see a big pill, I can't do it. Anyway, I don't want to depress you or give you anxiety. I want you to have these conversations. You can go to the HMSA office. They can pull up all your current medications. They can help you make good decisions. Because how do you decide whether you're going to jump on the $63 plan or the $190 plan? Which one is cheaper versus less costly, right? You're paying this per month, but are you saving it or are you more protected through the year? We do have, if you scroll down a little bit, we do have on this website, there are all of these resources. Please play on this page. Open them all. Look at it all. Okay? Use them all. How are we doing, ladies and gentlemen? Let me see. There's something in the chat. Okay, so I'm going to ask this. I'm going to address this again. So now all of a sudden, I've got Joe Blow going on this plan. He wants to come back to HPPA as soon as HPPA. Your employer, but if the employer takes you back, then you just get off of this plan, but you do keep your A and your B. Okay. Now, if you're really, really sickly and your financial situation is dire, There is another plan called the Advantage Dual Care for those that qualify for both Medicare and Medicaid. It's the hybrid between Quest and the Advantage plans. There is a process to go through with that. You do reach out to the HMSA, to the HMSA centers. There are some people, and they need it. And this is for the people where everything that I just read, there's no way they're going to be able to afford it, and they are living with chronic conditions where it's not about getting better, it's about living as fully as possible. So your situations could be unique. Please go to the neighborhood center. We're there to help you. So thank you, everyone. This is why Medicare went last. Didn't want to have this conversation in front of everybody else.
Any more questions for Luahiva? No? Well, Luahiva, thank you so much for taking the time to talk to our team. We really appreciate it. For all you know, you've heard me say it before, Luahiva's just a wonderful partner for us and so helpful and always willing to do whatever it takes to make sure our team is fully informed and taken care of. And I truly appreciate it. And personally too, you know how much you've meant to me with all the help you've given me over the years. So mahalo nui loa, really appreciate.
I had one question.
I wanted to.
One question.
Go ahead.
Who is that? Oh, go ahead. I'm not sure who was asking that.
The one question, go ahead.
I guess I just wanted clarification that if I did pick up the Medicare Part C and I did return to work with HPPA, so that would be the one to get rid of, right? Because I can't
That's
use it
correct.
in tandem.
That's correct. So let me great question. So Advantage plans are the C/D. A and B are separate and require separate. A is a passive transaction. It comes to you at 65. B is an active transaction. And if you choose an Advantage plan, then that's a CD bundle. That CD bundle, so we're going to pick a month. You're going to run Advantage from September 1st all the way to December 31st. HPPA has got the monies that it needed and is able to crank up. We've got the vaccine. The world is coming back to the Big Island. They're all coming, not just to the Big Island, but they're flooding everybody. Tourism is cranked up again. Everybody wants to go see all of the national parks. What you do is you cancel your Advantage plan. So if it's an Akamai Advantage plan, that's what you cancel. And you just contact HMSA to cancel your Advantage plan to ensure, and you want to make sure that it ends the day before you start back up with HPPA. Or let's say you decided instead you wanted to go be a door greeter at Walmart and they gave you 25 hours a week. Doesn't have to just be HPPA. It could be doing something like that, and you're able to qualify for their medical plan. If you're going back to commercial is my point. But you want it to end on the 30th/31st of whatever that month is, because coverage always enacts on the 1st of the month. Did I answer?
Yes, thank you.
Yeah. And so as I wrap this up, again, everything you do, please come to the neighborhood center. There's a lot of information. We keep a lot of information on our website. I do recommend going through it, and the people that we have at all three locations, I'm thinking of the Maui Neighborhood Center, thinking of the Kona branch and the Hilo branch. They are all empathetic people, and they're also detail oriented. So we do really good with hiring members who are able to communicate the way you need it. And one more final thing. You are not alone. Right now, on 7/31, over 600 employees on the Big Island alone lost their health care. So they may have been furloughed from their employers, but now their health care, which was previously covered under the PPP Act, they lost all those monies too. So this conversation we're having, I'm having it every day. It's tough. It's tough right now. Start with your doctor, all your doctors, to figure out your best move, and then look for the plan that's appropriate for you, whether it's Quest, whether it's Cobra, or whether it's Medicare. That said, aloha, everyone.
Thank you, Luahipa. Hui ho.
We hope.
Mel, this is Carolyn. Did you have anything to add in closing, or does anyone have anything that they'd like to ask Mel?
So as I said, we'll send out an email with the 2 links that Luhiva talked about, and also the slide deck that she went through, so you have all of that information. As I was playing with the Quest Are You Eligible page, very, very simple. And it looks like there's a very high income level, a pretty high income level for you to qualify. So, that is an option. There's, no premiums with it. But if you are wanting to stay on with HPPA coverage, and I know some of you have some special circumstances where you'd like to, you have the Cobra option. We'll also, Margot and I are talking about some other possibilities as well, and we'll be sharing that. So I think what I'll do is just reach out to each and every one of you, probably via email. And if you want to talk to me, of course, you're free to call me, and we can talk about your individual circumstances and what might be best for you. Okay. And then obviously everybody over 65 has another option. That is very interesting for me to hear all of that. So I'm glad that so many people stuck around to hear that. Even though I'm not 65 yet, it's not that far away. So I learned a lot. Okay, any questions for me? Comments? No? Okay, well, I'm going to turn it back over to Carolyn. Thank you so much for all of your time. I hope this was helpful to you.
Well, thanks again, Mel. That was really enlightening and quite a bit of information. So we'll go ahead and, as Mel reiterated, we'll make sure you folks have the slide packet and the links that you need. I just reiterate, go to your doctors, make sure, go to your HMSA, or you can go to your pharmacy to get all of those medications in one list and see what your costs are. So we wish you the best of luck. Hoping you have a wonderful week, and a hui ho until next week.
Thank you, Mel, for arranging that.
Thank you.